it's Holly Rigsby here with a Pregnancy Fit Tips video newsletter. Thank you again for everybody who sends in questions that they have about staying fit while pregnant. Just to let you know at this point that I'm filming this video, I am 36 weeks pregnant, and we get a lot of questions about the abdominal area. And are there any exercises that we can do or exercises that we should avoid when it comes to the belly area? Well, first of all, I would hope that when you become pregnant, your goal is not to try to keep your belly flat. So doing lots of sit-ups and crunches throughout your pregnancy, thinking that's going to help reduce the size of your belly or avoid belly fat. That's not the focus and the goal when you are pregnant. So I hope that you toss that out the window. What does make a big difference to the amount of fat or belly fat that your body does accumulate throughout pregnancy, because it will. You will add on the pounds for the protection and growth of your baby. However, it does not have to be extreme, and this is absolutely controlled by staying active and watching what you eat. Very simple advice, and yes, I'll have more videos on the specifics of that. But today's video, I just want to talk about what you should be avoiding when it comes to exercising the abdominal area. A lot of us talk about the fact that after having a baby, we have what's called diastasis recti, which is the abdominal separation, which can lead to a pooch after having a baby. And then wondering how to flatten that, because you can lose the belly fat, but then we still have that kind of pooch sticking out. So there are things that you should be avoiding, especially during your third trimester, preferably in your second trimester so you get into the habit. That actually increase the size of that diastasis recti. What am I talking about? What is that? Well, our abdominals are made of three major groups of muscles. The ones I'm going to talk about today are the rectus abdominis. That's what creates that six-pack that people have when they get very lean. The long muscles that extend straight down. Those are the topmost abdominal muscles. And when women are pregnant, due to a growing uterus and hormonal changes that actually soften the ligaments in our muscles and allow our belly to expand, our rectus abdominis, those muscles that stretch down this way, actually begin to separate and open to allow for that growing uterus. That's normal, that's acceptable. But when you are exercising while pregnant, you want to make sure that you don't exasperate that area and cause more of a separation than what is necessary. And this can come from being aware of, especially when your belly begins to expand and you do feel that your uterus is growing out and pushing out of these muscles. You don't want to do certain exercises that cause these muscles to lengthen and weaken and expand even more. What are those types of exercises? Your typical crunches and sit-ups. Anything that is causing your inner abdominal muscles, especially your transverse abdominis, which acts like a corset underneath your obliques and your rectus abdominis. And your obliques are your side muscles. The transverse abdominis are your innermost abdominal muscles, and they wrap around like a corset. So they start from here at your back, and they come around and wrap and connect to your ribs, and also are connecting to these long muscles in front, your rectus abdominis. So if you're doing exercises that are causing your belly, your core, to pull on these muscles, it's only going to widen that gap. So avoid things like the typical crunches and sit-ups. Avoid movements that have you doing anything that's like a crossover. You know, where you're lying down, you're trying to do like an oblique type move. That's only going to cause more of a separation. You also need to be aware of how you're moving your body, because basic movements like getting up out of bed or getting up off the floor can also cause more of a separation. And here's one, a lot of us, if we are, used to getting up and down off the floor, some of us will just kind of fall back and allow these muscles to kind of, well, when we didn't have a baby in here, we allow that strong core muscles to help roll us back. Doing that now is only pulling on your rectus abdominis, these long muscles and helping to pull them apart. So anytime that you go to roll back, whether it's to get down onto the floor to do an exercise or to lay in bed, make sure that you're using your arms and your legs to help guide yourself back, right? So that way you're coming down with that support. Then, from a getting up position, the last thing you want to do is strain and pull yourself up like this, because then once again what's happening is you're pulling those muscles apart. What you want to do is instead roll to the side and gently push yourself back up to that starting position. So there are some things to avoid. In the next video newsletter, what I will do is show you some appropriate core exercises that you can do to help strengthen the right types of muscles while your belly is growing and expanding, because these muscles are important not only for labor and delivery, but for a quick recovery after having a baby. And that's your transverse abdominis. We're going to come back with the next video next week, and I will tell you all about it. Thanks again for the questions, and keep them coming.